In the past, my perception of the hospital, just kind of like a little place where you went to, we call it a Band-Aid station. That was the impression that was here. And the changes I've noticed in the hospital in the recent years is they have become a huge part of their community. They have had different programs through this Delta region, the farmers market, the lunch and learns. They attend everything that we have for the chamber. They sponsor all the events for the different programs here in Kinder and all of Allen Parish and even Calcasieu Parish. And they have done an awesome job of getting back on the map.
So the first impression is a little overwhelming, but over time when we got into it and started seeing the assessments come back and we're able to identify the top 3 things that we needed to work on and have a plan, it was really easy to focus the team on those opportunities and get things done and work towards the goals that we had set. So the TAs were always very value added to the team. I think the leaders grew from them and took away 1 or 2 little tidbits of information that they could implement to work on staff retention and work on keeping their staff happy. Our employee satisfaction score after the 3 years in this program is at a 4.53 out of 5 on Press Ganey. And we're about to get an award, 2 awards actually from Press Ganey for our employee satisfaction is one of them, and for our home health scores.
We have focused on customer service, we've focused on quality, and we've focused on bringing the right people into this organization that can help move us forward. And so the community, they see what we're doing, they see that we're investing in the local community, we're investing in local people, and we have their interests at heart. They don't have to drive to receive the best care for what we do here.
The community is perceiving a turnaround in the hospital by making appointments with the new clinic. Those people have come back in their community and said, man, the service was great. It was easy, it was fast, it was quick.
HCAHPS scores are the patient's perception of the care they receive from us. After their visit, they are sent a survey out via mail or email for them to answer how their experience was at our facility. Our ER scores were probably in the 80s when we began the project and topped out in the 90th percentile, which is pretty unheard of for an emergency department.
The primary challenges that this specific rural community faces, we try to pinpoint 3 focus ideas when it came to the Delta program, which was transportation, mental health, and then just economic resources in general. The Delta program helped us in different ways with each factor. Mental health, we incorporated a farmer's market and also a lunch and learn that we do here, so it helps the community come together. It's a way to get people involved to where they're not just coming here to get well, they're coming here to go to your farmer's market, go to your community garden, and it's just a way to promote healthiness all around.
You know, it's rare that you get to participate in a program that has lasting benefits. And this program that we've done through Delta is one of those programs that if the organization adopts it and believes it, and if you do that, and if you embrace it, then you'll succeed.
The support we received from the Delta program was imperative to the success we have gained from it. Each step of the way, we were met with, how can we help? It was very well thought out, very well planned. We were able to even open a telemedicine service.
So the future of Allen Parish Community Healthcare is the community seeing us as their wellness hub, their place where they come for health and wellness. And if they need us for sickness care, they come here too, but they see us as a partner for them to be healthier in their own community. So I think that's the biggest thing that Delta has brought, is that community relationship. Through the community champion, the relationship that we have with the community is 10 times better than what it was when I first got here.